It's Mix 94.1, Mercedes in the morning. We were talking earlier about how multiple arrests have been made in the death of Matthew Perry, and we were talking about ketamine. And there's a lot of talk on what he died of. Was it because of ketamine? And we've been taking a lot of calls. We wanted to talk to an expert, though, because, I mean, this is the only way we are going to understand what ketamine does. And that is our guest, Dr. Richard Bennett. Good morning. How are you?
Good morning. I'm great. How are you?
Good. Thank you so much for coming on. You opened Las Vegas Ketamine in 2021, and you have been helping people who suffer from depression, anxiety, OCD, pain with this drug. And I feel like there's a lot of talk about it right now. What are your thoughts on the whole Matthew Perry situation?
Sure. So I think there's a lot of misinformation and misunderstanding with this situation. Starting with the way he died. In the coroner's report, it talks about how he died from a ketamine overdose, and I really don't think that's the case. While it is possible to overdose on ketamine, because it's possible to overdose on literally anything, I really don't think that was the cause of his death. And the reason I say this is because long before you get to the level where you can actually overdose on the medication, you enter into a state that we call dissociation. And dissociation, it's not unlike being extremely drunk. Are you close to death? Not even remotely close, but you would be extremely impaired, okay? And now, let's say you got extremely drunk and you went swimming. There's a reasonable chance you're going to drown. It literally happens thousands of times every year in the United States. Now, if you found someone who died when they were swimming and they were super drunk, are you going to think they overdosed on alcohol? Probably not. You're going to think, well, they were really impaired, they went swimming, and that's how they drowned. I'm almost positive that's what happened to Matthew Perry.
Well, I guess maybe we should backtrack a little bit. Like, what does ketamine do to your body, and how does it help people?
That's a great question. So for the longest, the use for mental health is actually a relatively new use for the medication. It was invented in the 60s, and it's been in very common use in every hospital since the 60s as an anesthetic. But the psychiatrists started to discover that it actually has a very, very strong antidepressant effect. And so you take someone like Matthew Perry, and there are a lot of people like this. I see them every day in clinic. They can come in, they have treatment-resistant depression, they're suicidal, they have all these horrible mental problems, and you give them ketamine for several weeks. That would be about 2 infusions a week for several weeks, and their suicidality almost completely disappears.
We're talking to Dr. Richard Bennett. He opened Las Vegas Ketamine back in 2021. So my question for you, doctor, is I have these issues, depression, OCD, and I go see you and I start taking the ketamine treatment. Is there any concern? I've never had ketamine before. Any concern that your patients will leave there and they're now addicted to ketamine like Matthew Perry was, and they start looking for avenues to find it outside of your clinic to get that fix?
Well, it's possible. I mean, it's very rare. Typically, people who come in like that are addicted to something else, usually whatever they're self-medicating with, whether it's alcohol or opioids or whatever. But as mentally they improve, typically their addictions improve as well. So I have people all the time who tell me that they've actually stopped all of these substances that they're taking. Now, sure, is it possible that someone could do what Matthew Perry does? Yes, but I haven't seen it.
Is it a drug that you feel it has like a numbing effect? Does it have does it release endorphins? Like, what is the feeling that you get on it?
The feeling you get on it is it's almost impossible to describe, but while you're actually on the medication, it's almost just kind of resets your brain. Think of it as a reset of your conscious mind. Everything just kind of goes blank while you're on the medication. And then it's after that you actually see the positive effect. Typically, for several days after, patients they'll tell me how things that normally really bother them or trigger them, set them off, they just don't seem to bother them that much.
I have a friend in radio in another city, and she said that ketamine literally saved her life. I mean, she really says that it turned her completely around. And it's just, I think a lot of people are unsure of it. They don't understand what it is. And Dr. Bennett, we really appreciate you taking the time this morning to explain it to us.
Thank you very much. It was nice to be here.
Yeah, well, if anyone wants to get in touch with you, if anyone has any questions or interest in this, how do they get in touch with you?
The best way is just to go to our website. It's easy to remember, LasVegasKetamine.com. From there, you can call, you can text, you can send us an email, LasVegasKetamine@gmail.com. And we're very responsive to any questions.
All right. Awesome. Thanks, Dr. Bennett. I appreciate you.
Thank you, buddy.
Thank you.
Thank you.
I just got a text. I reached out to the friend of mine that has been undergoing ketamine treatments for years and says that it saved her life, and she said she'll come on the show.
Really?
Yeah.
Oh, let's get her on there.
And find out, like, what is it like as someone who takes it and uses it and how it turned her life around. So coming up in just a couple of minutes, we will talk to her and get her firsthand account about this drug. I'm very confused by it. I don't really understand it. And so it's nice to get some more insight on it and what it is exactly.
We'll have Mercedes' friend here coming up in about 6 minutes. Mix 94.1, this is Mercedes in the Morning, always streaming live on the Odyssey app.
This morning, we've been talking about Matthew Perry. Multiple arrests were made in the death of Matthew Perry. 2 doctors, the actor's personal assistant, and 2 others have been charged with providing the ketamine that led to his death. And an autopsy report confirmed that he had passed away due to the acute effects of ketamine. We just talked to a doctor that administers ketamine. I think we just want clarification on what exactly is it about this drug. Is there a risk of addiction when it comes to taking this drug? What does this drug do? And I made a comment earlier that the first time I had ever heard about ketamine, I never had heard of it before, was in talking to a radio friend of ours that I just love and respect so much. And she has her own show in Chicago. Her name is Angi Taylor. And she talked about how it literally changed her life. And Angi is on the show. Hi,
hey,
Angi.
Hi, guys. Hi, Queen Mercedes. How are you guys doing?
We are so good. And you are on vacation right now, but you still took the time to come on the show. Thank you so much for doing that. Where are you right now? The Bahamas?
We're in Jamaica for a wedding, like a destination wedding, honey. I'm poor already. Enough with the destination wedding.
Well, I don't know if you remember when we were in Chicago, Angi, and you and I were talking, and you brought up, someone brought up ketamine, and you said, ketamine treatments have changed my life. And we're hearing all this news about Matthew Perry and his overdose on it. And I'm like, well, when I've heard about it, it was through Angi and just talking about how it helped you. Can you tell us a little bit more about that?
Yeah, I mean, I have been a person who has struggled with depression, anxiety, PTSD, like my whole life. I grew up in a very domestic violence house. And so I have been in therapy. I have been on depression and anxiety medications since I was a teenager. And I had just found that I've gone through waves of times where it just didn't feel like it was doing the trick anymore. And then about 8 years ago, in 2017, when ketamine was very new on the block, we found out about my husband also has been on ketamine therapy. My brother, who is a Army Ranger veteran, has been on ketamine therapy for his PTSD. We found out about the treatments and found and researched, of course, because it was kind of a new thing. And I'm like, I don't know what this is. I knew about Special K. I knew about the party drug. I knew about the K-hole. But I was like, how is this going to help me? And then started getting the IV treatments. Like if you go to an IV clinic or something. But this was ketamine. Doctor administered, of course. It's microdosing. And it was just a supplement to the medication that I am still on for depression and anxiety, but it's a supplement. And it really was it really is, I should say, helpful. And has changed my life because I don't know what it is about the microdosing of the hallucinogenic drug that is ketamine, but it just, I don't know, everything is kind of more chill. And I feel like as somebody who is depressed and has anxiety, that my responses to things are not as deep or dark as they would have been without the ketamine. Like everything is just a little bit more chill. I feel like I'm on an even level, if that makes sense.
Go ahead.
Was it when you're doing the treatments? What's the treatment like? Are you completely passed out and out of it when you're doing the treatments, and the doctor has to wake you up? That's what I'm envisioning when you're telling me you're doing these ketamine treatments.
That's a great question. No, the treatment is you're in a room, at least in my clinic, and then you're laying on what seems like a lazy boy couch. You've got a weighted blanket on you. You've got like a sleepy eye mask on you so you can relax. Your heart rate is monitored, your blood pressure is monitored, and your oxygen levels are monitored. And they put an IV in you, and you sit there and chill out for about 40 minutes. It is a little psychedelic, you know what I'm saying? And I kind of look forward to that sometimes, to be honest.
Well, do you hallucinate? Do you see things? Like, what do you mean by that?
Like, you're just kind of in a trippy state. So if you've ever gone under anesthesia, like, you know, right before you go under the anesthesia where they're like, all right, count backwards from 10, it kind of is that you're in a twilight, I would say. So you're not asleep, but you're not lucid, awake. You know what I mean? Like, you're just kind of in a twilight. And then, you know, it's very, very monitored. There's cameras on you. All the monitors are going to the doctor, so you're not alone. And that's the part that was sad about Matthew Perry, is that it should be doctor monitored. It should be microdosed. They should be monitoring all of your levels and your rates and everything in your body. And then when you come out of it, you're a little loopy, you know, like you're kind of drunk, so you don't drive home. But within an hour, you're fine. And then, you know, life is kind of normal again. It's one of those, I feel, for me, and I know, like, for everybody, whatever depression or whatever anybody is going through, your journey is different. But for me, it was a life-saving thing, for sure. And for my brother, it was. For my husband, it was. I really encourage people, if they're interested, to really research it and really find the reputable clinic and not go to, you know, some Jiffy Lube, and we also do ketamine.
Yeah, exactly.
Darn it.
Hey, Angie, I know we got to let you go, but I want to ask you one question that just came in on our text line. It says, I've heard from a doctor that I went to see that when you go to do the infusion, if you have any invasive thoughts as you're getting it, you'll trip out like really bad. So I've been scared to do it. Can you ask her about that?
Oh, that's great. That's a great question, because I feel like everybody thinks about that when they, you know, do anything that makes you hallucinate, like if you're in a bad state. So what I always did was, you know, like the music that you hear when you go into a spa, like the really zen, chill music. I would have that in my headphones. You bring headphones because you want to have some music, but you don't want to have music with lyrics in it where it makes you think about things. You just want to have like music that sort of just makes you serene, like you're on a beach and you're just relaxing. So that part, because if you're listening to like hardcore rap or rock or something, you're going to get into the lyrics, and then yes, it can make you go to a place you don't want to go.
Okay. Yeah. So, Angie, you're so like, gosh, I love that you're so open about this. And I think it helps people so much. And if you're ever in Chicago, you have to listen to Angie's show. She is like incredible. One of the biggest inspirations in radio. And we just love you so much, Angie. Thank you so much.
Oh, you too. I love you guys too. Vegas is so lucky to have you. Love you guys. And thank you for having me on.
Enjoy your wedding.
Bye.